starting in supine position after standing down, right? So one of the major questions that we ask our patients every day as a follow-up with them, when you first see the patient, any falls to report? Did you fall last week? So we ask this a lot, right? So falls, maybe patient falling on their back. And in this case, this patient may have hypoglycemia, hypoxia. They are trying to reaching for overhead things. This may result in head and back injuries. Speedy recovery from this position should be contraindicated. Okay, you ask your patient to wait a little bit. Make sure that everything is in place. No fractures, no sharp pains. Okay, so the patient should not recover immediately after they fall. The patient, the least thing that may come if they are old age people. Okay, they may come with position of vertigo. Okay, when their head hit the ground. Okay, they come with vertigo sometimes. They may come with hemorrhage. And in this case, ER, CT scans, MRI, a lot of things will be done for them, right? And sometimes their head does not hit the ground or the floor or anything, or they fall on a carpet or they fall on a soft thing and everything goes well, right? So we may see those, right? But you have to report every time that the patient fell. A patient may fall on their face, right? Trip on something. And in this case, it would be having a foot drop or dragging their toe. Or they have a carpet, so they trip on that, right? So in this case, this patient may also have a head injury, knees, elbow, whatever injuries that may result. The patient who falls to one of the sides, it could be a stroke patient. They have a weak side, so they fall to the affected and posterior. This is a common thing, but they may fall in any direction, right? But the common thing, it's the affected side and posterior. Patient with Parkinson's, same thing. Okay, side on the side, and this would be the position that they would have when they fall. So we have taught our patients to move from supine to prone, right? The sideline first and to prone. So first of all, the patient needs to scan the environment around them to find something very close, like a chair or something like this. Okay? And then they start rolling. We taught them how to do that. We also taught them, after rolling, to go to prone and elbow, right? And from prone and elbow to quadruped, correct? And from quadruped to kneeling and half kneeling. And after kneeling and half kneeling, they can start transferring themselves to a very close thing, like a chair, ottoman, right? Anything, a couch. Okay, so whatever we taught them today was starting position, supine or prone or sideline. They have to turn, move to from sideline to prone and elbow, from prone and elbow to quadruped. That's why I told you, quadruped position is very important for recovery from falls, okay? And then they may need to do some creeping to move close to the chair. If the chair is far from them, they have to do this. We taught them how to do this alternative movement, right? And then from there, they start this half kneeling position, kneeling and half kneeling. And then they can move themselves from half kneeling to sitting or standing on a chair. That's how they recover from falling. We used all what we did today for them. And all what we did today is really help. This what you actually do in the hospital. Teach them how to do the transfers in the bed, right? To do squat, to do bridging. Next time, we'll continue doing the transfers from a wheelchair to bed, bed to wheelchair. Okay. We taught them today how to be stable in sitting position. So they need that for all the ADL. We're not there yet for standing. So during the acute care, a few weeks after the stroke, they would need this. Okay. So this is what we had today. And let's see this patient. She's an MS patient.
Shoulder flexion with overhead reach.
Doing the kneelings.
Works on trunk strength and control.